Hi, my name is Eli.
Hi, my name is Samuel.
Hello, my name is Santiago Pozo.
Hi, my name is Victor.
Hi, my name is Sean.
Now, this topic is pretty important to me as someone who comes from a immigrant family from El Salvador who has also been diagnosed with severe mild depressive disorder. Kind of bringing light to this topic is something that has always been kind of like an overarching theme in my life, and making sure that a lot of people, especially in my family and in my outreach, are getting the help that they need.
The reason why I decided to continue with this project is because I personally have gone through struggles with mental health. I've had friends and family also go through some struggles with mental health, and I think it's important to recognize some of the issues, specifically in minority communities and minority culture, that may be preventing certain people from receiving the proper treatment for their mental health issues.
The reason why I hopped on this project is because I have several friends who have been diagnosed with different kinds of mental health disorders. And there's a lot of stigmas related to these mental health disorders that not a lot of people realize are out there. And these stigmas carry a lot of weight on my friends' day-to-day lives.
Especially in the workforce, mental health can easily just be ignored and you can suffer through a lot of burnout. And as a full-time student and worker, I've definitely experienced my fair share of burnout, and I feel like it's important to spread more awareness about it.
I'd also like to bring awareness about what it is to be an immigrant and its correlations with mental health. I believe that every human should be able to talk about their mental health and express the way they feel without having to worry about what others might think.
We need to talk about this.
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 A lot of people have described something of a mental health crisis in this country.
It's called one of the greatest public health challenges of our time. Our nation's mental health is in crisis.
Experts are warning teens and younger kids all across the country that they are in the midst of a real mental health crisis.
The mental health crisis.
Mental health is a serious crisis.
And it's not difficult to see why.
Children visiting ERs for issues related to their mental health has skyrocketed, with research showing visits increasing in kids ages 5 to 11 by 24% and rising 31% in ages 12 to 17.
The CDC reports a 48% increase over the past year of emergency room visits for teens who've attempted suicide.
According to the latest National Healthcare and Quality Disparities Report, nearly 20% of children between ages 3 to 17 have a mental, emotional, developmental, or behavioral disorder.
These feelings of sadness, despair, hospital visits, suicide rates going up and up and up. But let's take a second. What exactly is mental health? We hear this term a lot, and so it can be kind of hard to define, or maybe we're unfamiliar with it. And so to explore and learn a little bit more about what mental health is, we decided to interview and talk with a mental health counselor, a teacher, and a fellow classmate.
Yeah, my name is Luke Merrill. I am a licensed professional counselor in Illinois, and I've been practicing for about 3 years now. And I work primarily with kids and families, and I also see adults. Before I was a counselor, I was a youth pastor for about 5-6 years, and I saw during COVID how many of my students had anxiety and depression and other mental health concerns, and many of them were isolated. They were having hard times, so my heart went out to them. And so I went back to school. I got my master's in counseling and really fell in love with it. And so my heart is to see kids, teens, and adults and families have healthy mental health and live their best lives.
So my name's Theresa Aldrich, and I have been teaching for 16 years. And my background in mental health work is just within the classroom. So I teach AP psychology, I teach about mental illness as well as the brain and typical and atypical behaviors. I just wanted to teach people. So I actually fell into AP Psych on accident. I had a major in history, but fell in love with psychology, got the chance to teach it, and have loved it for 15 years.
Well, I'm Jacob Hutter. I've been a CLC student for a couple semesters now. I graduated from MHS 23. I would say it's almost just like your own well-being, your emotional well-being, and like just how much you can push through your day. There's an analogy I use where I almost put mental health as like a gas tank. You don't run your car till it's empty, so you can possibly run out of gas. You go in halfway, so then you should fill up your mental health the same way. You shouldn't run yourself down until you're broken down.
I think mental health is a lot of different parts. I have one worksheet I use with clients that has a whole person wheel, and in the center is our spiritual life. And with Christian counseling that I do, I think faith is really important. And from there we have our emotional health, our mental health, our physical health, relational health, our volitional health, which would be the choices that we make. But when I hear that word mental health, I think about emotions, I think about thoughts, I think about behaviors. And with emotional health, when we have a high EQ, that means I can know how I'm feeling, I know what that means, I know how to communicate that with others, and then I also know how to empathize with others who are hurting or feeling a certain way, that I have good interpersonal skills as well.
I would say feeling your best, feeling healthy, feeling positive would be the positive, healthy side of it, right? Mental illness is when you're not feeling those things.
One definition given by the CDC is mental health is the component of behavioral health that includes our emotional, psychological, and social well-being. It is a state of well-being that enables us to cope with the stresses of life, realize our abilities, learn well and work well, and contribute to our community. Mental health is part of a grander, more holistic approach to health that deals with our emotional state as well as our ability to cope with some of the events that happen around us, our environmental changes.
I've had struggles with self-esteem and self-efficacy from high school and a little bit into college. Self-efficacy is your belief in your abilities, and self-esteem is just your general rapport for yourself. Because I've always just thrown myself out there, not really caring for who I am. I just care about how I play into something. So that's always been a struggle, just like actually having any care for myself and saying, oh, I could do this, or actually just having any pride behind myself. I have a friend that has MPD, and that's been a bit of a struggle trying to help him out with that. Or also I have a friend that has BPD, and so that's, I've seen lots of extreme examples when it comes to mental health, and I think it does put in perspective how important it is to me with, I would say not minimal problems, but I mean comparative to PPD and MPD, or major depressive disorder and bipolar disorder. It definitely puts like a good lens on me to make sure it's important.
Burnout. It feels like, especially in teaching, there's just so many things to do and not enough time. So I think that, especially in our culture, it's an environment of work without much else that's prioritized. So mental health is not prioritized, sleep is not prioritized. So I think burnout is real.
I think second semester, I definitely experienced burnout. I thought I could handle a 30-hour or like 25-hour work week along with theater, along with 4 classes, and it really was, I've experienced both the academic and physical burnout. It's not fun.
It's important to remember, though, that mental health is not just about the absence of a mental illness or a mental condition. It is kind of like a spectrum, in the same sense that being physically healthy isn't just about the absence of a disease or not having a disease. That being said, mental illness is a serious issue and a problem that needs to be discussed and talked about.
I think a lot of people in the public don't understand mental illness, and there's a lot of stigma surrounding it. So if people just took a course or, read about the disorders to understand how common the symptoms are and also how much treatment could help them function. And I think it would just help us better understand one another if we were educated.
A mental health condition can be defined in the DSM, which is the diagnostic manual that we use as clinicians. And so there's criteria for each one, and so it gives a breakdown of what is anxiety, what is depression, what is ADHD, etc. And so I think a good definition, a very simple one, would be any kind of emotional, mental, behavioral challenge that comes up that is impacting the individual or the people around them.
There are lots of known and researched mental health disorders out there, but there are there's a big three of sorts, where they're the most common you'd see in the workplace, and that would be depression, anxiety, and bipolar disorder. And depression, it's a very common mental health disorder, often characterized by just a lack of joy, a lack of pleasure in activities, especially activities that you used to enjoy.
Because we use the term depression in our regular speech as a colloquial way of using it, I think sometimes people fail to understand that that's not what we mean. We don't mean, boy, my team lost. I'm really depressed today. We're talking about a brain disorder. We're talking about a condition where people, even under circumstances where they can recognize they have all the blessings and everything going well in their life, just have no desire to live. They can barely get out of bed in the worst kinds of situations. Their reward centers in their brains are shut down, so they can't really feel pleasure from things that they may have once really enjoyed and been passionate about. Everything seems to be flat and more so, maybe even dark and painful, to the point where imagine somebody overriding the most powerful instincts of survival to actually have an instinct for the opposite, wanting to end their life. So I hope that gives everyone watching a sense that this is really a disease, a powerful disease. This is not somebody who just doesn't understand how to be grateful for something.
And approximately 280 million people globally do suffer from depression. And then anxiety is definitely another common one in the workplace, where it is characterized by an excessive fear that inhibits with your daily functions.
Hi, I'm Dr. Melrano, psychiatrist at Brigham and Women's Hospital and Brigham and Women's Faulkner Hospital. Anxiety is a normal phenomenon that we all experience. It can range from nervousness about everyday situations like a first date to fear, an intense fight, flight, or freeze response that helps us escape life-threatening situations. Anxiety becomes a disorder when these responses overwhelm a person in a way that is disproportionate to triggers, for example, excessive worries, fear of social interactions, and panic attacks. Anxiety itself is not inherently dangerous. In the right amounts, it can motivate us to plan and perform at high levels. However, when prolonged and overly active, it can lead to worse outcomes, such as poor sleep, depression, and even suicide.
And about an estimated 301 million people globally suffer from some sort of anxiety disorder. Bipolar disorder is characterized by extreme mood swings. The high end, where it's mania, where you feel great, and then you go all the way down to the low end with depression.
Hi, I'm Dr. Andrew Nierenberg. I am the director of the Daughton Family Center for Bipolar Treatment Innovation at Mass General Hospital. So bipolar disorder is a mood disorder where people experience either manic episodes or depressive episodes, or even episodes where those things can be mixed. The symptoms of bipolar disorder are the ups and the downs. The ups are called mania, the downs are called depression. When people have mania, they have increased energy, they're restless, they're distractible, they can be irritable, euphoric, grandiose, they can be talking fast, they can be thinking fast, and they can take risks that they wouldn't ordinarily take. And interestingly enough, they have a decreased need for sleep and they're still full of energy. On the downside, they can be depressed, sad, have guilty ruminations, can't get it out of their head, have either insomnia or they're sleeping too much, or they're eating too little, or they're eating too much, can't concentrate, can't function, and they can feel so bad that they think about suicide and sometimes act on it.
And then with bipolar disorder, it's another one where a lot of people are incentivized to just keep quiet about it in case of any workplace discrimination. Like opening up about it could easily lead to less opportunities, less chances for, let's say, promotions and whatnot. And so again, it leads to people not getting the help they need, and then they continue to suffer from it in silence while still working, as the stress just keeps gnawing at them.
And what could be the cause of that? Well, there's a lot of different things, Sam. I think naturally we have things in life that happen, and some of us have experiences, trauma that we go through. Sometimes it's from other people, sometimes it's things that we do to ourselves, And so it could be inflicted on ourselves if it's something that we're doing. If we're spending a lot of time on social media just scrolling and we're not getting enough exercise, we're not sleeping well, maybe we're not eating the best foods. But then also there could be a biochemical thing in our brain. There's a lot of reasons why people struggle.
Mental health is affected by three major forces: biological, psychological, and sociological factors. The biological side includes things like the mother's health and stress during pregnancy, whether they were substances like drugs or alcohol in her system. Genetic vulnerabilities may also affect the way that mental health affects a human in later stages of life. It's not only based on what the mother did during pregnancy. The psychological side has to do more with how the person was raised. Were they supported emotionally? Did they have healthy relationships growing up? Were they bullied at school? Did they feel alienated? Childhood trauma, parental behaviors, and feelings of isolation can all affect how a brain develops and copes with stress in later periods of our life. The third factor is sociological. The environment someone grows up in dictates how their mental health plays out. For example, living in poverty, where food and safety come before emotional well-being, can create chronic stress.
You have poor health, then that's also going to have an impact on your mental health. And so if you're not getting the appropriate treatment for your diabetes, for example, it's natural that you're also going to have anxiety. If you can't afford to pay for the prescriptions for the treatment to manage your diabetes, that also can contribute to anxiety.
Lack of access to education, shelter, or stable family structures can severely limit emotional development and leave a person constantly in survival mode, instead of being able to focus on self-growth or mental health.
Mental health in displaced communities is something that is becoming a more and more relevant topic as we delve further into mental health.
Studies show racial minority groups show higher levels of anxiety, depression, suicidal tendencies, post-traumatic stress disorder, and other mental health disorders. According to the Health and Human Services Office of Minority Health, minorities in the U.S. are 20% more likely to experience mental health problems. Doctors say there are many reasons why, including lack of access to health care.
A lot of factors, including those of lower socioeconomic history, kind of trauma and migration, a kind of troubled family, and most importantly, stigmas that surround immigrants in these communities have an incredible effect on their mental well-being and mental health that from day to day affect them.
In some cultures, there's stigmas around mental health within that group, and in ways of care for these groups, I'm just curious about that. I would love to look up some statistics, but I see clients from all different kind of cultures that come in, and I've seen how some families from various cultures might see mental health as bad, or we don't like to talk about it. So I think it is hard for them to come to that. So I wonder if there is a shift that is happening and conversations happening in different cultures, which I think is great. And I want mental health to be accessible to anybody that would need it.
Doctors say aside from lack of access to health care and socioeconomic factors, there's also a stigma surrounding mental health. Some people may feel ashamed to seek out treatment, or maybe their family members don't believe in it.
And in many minority communities, admitting you need help can be seen as a sign of weakness. Why is there so much reluctance, and what can be done to break the stigma? We're joined this morning by psychiatrists Dr. Tamika Anderson and Dr. Kinwal Sadhu, both with Community Health Network. Good morning to the both of you, and thank you for joining us this morning.
You know, the Black community has had to endure quite a large amount of adversity and has prevailed through that. And so oftentimes in the Black community, it can be perceived as a weakness or an embarrassment to admit to needing help, or to feel overwhelmed and helpless or sad or anxious and worried.
Latinos as a race face an incredibly high amount of mental health disorders, those being anxiety, depression, and post-traumatic stress disorder. More than 1 in 5 Latino Americans report having dealt with or dealing with a mental illness. Yet, compared to the 52.1% of white patients that were able to seek and get help for their mental health, only 36.1% of Hispanic and Latinos were able to find and get help from the services that they needed. According to 2021 data from the American Psychological Association, more than 80% of the country's psychological workforce was made up of white psychologists. Latinos, on the other hand, make up a mere 8% of the psychology workforce.
One major barrier that a clinician I spoke to here at DLC says that minority communities face, and that's not seeing themselves in their provider.
It definitely impacts mental health as a whole.
Sajay Caceres has been an outpatient clinician at David Lawrence Centers for Behavioral Health's satellite office in Immokalee since October.
The fact that I'm multiracial and speak several languages, I think that already provides that window for people to be even more attracted to look for their likeness in their clinician. A lot of times people that don't see their likeness in their providers are not feeling embraced. So that is something that keeps people away from seeking out mental health services or healthcare in general. They don't feel that they will be seen, understood, and accommodated by their cultural needs.
She says to change that narrative,
it's important to acknowledge your own culture when you're providing services, as well as acknowledge the culture of the person sitting across from you. It dictates care, it dictates diagnosis, it dictates treatment.
Hola, mi nombre es Agustina Garcia. Soy de la comunidad latina, específicamente de México, Cuernavaca, Morelos, ahí nací. Tengo 39 años. Llevo casi 15 años viviendo en este país. Es un país muy bonito. Afortunadamente hemos recibido muchas cosas, mi familia y yo. Desafortunadamente en el ámbito laboral, en el idioma, han surgido muchos problemas, podríamos decir, debido al racismo. Desafortunadamente mi lenguaje materno es el español. He aprendido el inglés, no al 100%. He sufrido discriminación laboral, discriminación en los hospitales por no saberme comunicar bien con las enfermeras, con algunos doctores. Debido a todo esto del racismo, de la sociedad que muchas veces no nos acepta como comunidad latina, con el día a día se me ha llevado a sufrir estrés, ansiedad, hasta depresión. Desafortunadamente, mi cultura latina, nuestros padres no nos enseñan, no nos educan para que nosotros como comunidad podamos ir y hablar con un psicólogo, hasta con un psiquiatra y obtener la ayuda necesaria. Es un tabú todavía para nosotros.
So what can we do about our mental health? It's the big question at the end of all of this.
I think that they should know there are protective factors. Like there are things you could do every day to keep yourself well, and they're not hard. You know, it's things that a lot of us know about, but we just don't do. So sleeping a good amount, practicing gratitude, having community, right? Friendships. It's little things that we just don't often prioritize.
CAPS is the psychological services here at CLC. I would 100% recommend CAPS. I mean, I know it's, when I first was going into psychotherapy or talk therapy, like back in high school, it was very daunting. Like you would think that therapy is only for the worst of the worst, or like not really for everybody, but it really is. I feel like almost everybody should just be once a month, you know, or twice a month, however often, just talk therapy, like with CAPS or some kind of counseling, is very beneficial, and I really recommend that.
Yo he aprendido en este país que nosotros somos libres de buscar la ayuda y de que no hay nada malo en pedir ayuda psicológica. Nosotros podemos ir y decir, ¿sabes qué? Necesito la ayuda porque estoy pasando por estrés, por depresión, por ansiedad.
Let me give my Peppers checklist. I'll give it to you quickly. The first P is people. We need to be around people. Don't isolate. E is for exercise. I think everybody should exercise, especially if we're feeling depressed or anxious. A lot of evidence is based in exercise helps get rid of that stress. The next P is productivity. Are we doing something every day that's productive? I think especially for people that are struggling with depression, it's hard to get moving and we feel overwhelmed by all that we have to do. And I think one thing at a time is a great way to approach that. The next P would be purpose. Do we have a reason to get up in the morning? If we don't, take time to discover our purpose in life is so important. The next E, I combine eating and sleeping. We need to eat well and make sure we're not sleeping too much and not too little. And then R is relaxation, which are we doing something to relax each day, to unwind? And last is service. I think helping others does help ourselves.
If you feel that your mental health is taking a turn for the worse, one of the first steps you should take is to reach out to someone that you trust.
Reaching out to somebody nearby, forming a support group either with friends and family, as we would recommend reaching out to a trained medical professional such as a clinician, a therapist, or a counselor, someone that can guide you along your mental health journey and give you the proper diagnosis, possibly even medication.
Our emotions can be complex and hard to understand. You don't always have to navigate them on your own.
You're not alone. If you need help, please reach out. We live in a world that is oversaturated, I would say, at times with mental health resources. There's just so much. So if you need resources, look it up, ask for help. And if you are in crisis, 988 is the suicide hotline. You can call or text that number.
And it goes both ways too. If you see someone around you exhibiting signs of mental illness or a mental disorder, don't be afraid to reach out.
Some common signs of declining mental health include rapid weight fluctuation, irritability, lack of sleep, and brain fog. If you recognize someone who is going through these symptoms or any other mental health symptoms that you may be able to identify, don't be afraid to reach out. Your small action can have a major impact on their life.
A lot of folks, as we've discussed, don't have good access to mental health care. And for them, we recommend free local or online resources such as NAMI, which is the National Alliance on Mental Illness, the nation's largest organization for mental health. You can actually donate today to our fundraiser that we've set up with NAMI Chicago that will help with local support groups as well as a helpline and many other important services that are given to the Chicagoland area. You can find the link to that fundraiser in the description of this video as well as on our website, which will also be linked in the description.